Judges, our team has presented this project for the MediHacks Hackathon, and the title of our project is AI-powered mental health and medical report assistance. The tech stack that we are using for the project is Microsoft Azure, OpenAI API, Streamlit, and RAG model. The problem stated that we have identified that are very crucial to be addressed are first the mental health issues. There has been a growing mental health concerns globally. There's a lack of accessible and immediate mental health support, and there's a stigma associated with seeking mental health. And the second is the medical report complexity. Difficulty in understanding medical reports. Patients usually struggle to interpret medical terminologies that are very complex to interpret, and there's a need for specified and accessible medical information. The solution that we have brought up is the first is the AI-powered voice chatbot, and that is an AI model that is provide mental health assistance. Users can provide a voice chat with AI to discuss their mental health issues. The chatbot offers empathy, advice, and coping strategies. And the second is the medical report passer, an AI tool that passes medical reports, provides a summary for the medical report in simple terms. User can ask questions related to the report for further clarification. Uh, Let me demonstrate the RAG model that we have used. First, we will provide the report on which would be the knowledge basis for the LLM. It would store the report in form of vector embeddings and as well as the notes in form of document chunks. Then the user will provide the query in form of voice recording or the text format. It will do semantic search for the query on the stored embeddings, and then it will be passed to the LLM model, which will give appropriate response for the query on the basis of the document that it has stored before, and the response will be passed to the users in the formats necessary. So the impact that we expect from the solution is first the mental health chatbot. It would provide medical immediate support, reducing the barrier to mental health assistance. It would promote mental health well-being and reduce the stigma. It will also provide 24/7 help when it's needed the most. Medical report parser. It will empower citizens with a better health understanding of their health. It will facilitate more informed discussion with healthcare providers and reduce anxiety and confusion related to medical information. For the first use case, let's assume a scenario where the user feels anxious and needs someone to talk to. They can just open the app and start a voice chat with the AI chatbot, and the chatbot would listen empathetically and provide personalized advice and coping strategies. This let's assume the second use case to the medical report passing. The scenario where the user uploads a complex medical report that would be generated from the laboratory test. They will upload into the report into the app. The parser breaks down the report into simple, understandable terms, highlights key points, and provides a summary. User can ask follow-up questions and get clear answers. Thank you. We will now move forward with the demonstration.
So hello everyone, I am here to demonstrate my project. So we created a mental health chatbot. So I give a demo to my project. I start a session with my chatbot. So my first question to chatbot is hello, my name is Sumit.
Hello Sumit, it's nice to meet you. I'm here to listen and support you. How are you feeling today? Is there something specific that you would like to talk about or any concerns you would like to address?
So here is the response generated by the chatbot. So I ask the second question. I don't know how I am feeling.
That's okay, Sumit. Sometimes it can be challenging to pinpoint our emotions. Let's take a moment to explore what might be going on for you. Are there any recent events or situations that have been on your mind? It could be helpful to start there and see if any emotions come up as we discuss them.
I don't like to share with you.
I understand that it can be difficult to open up and share personal thoughts and feelings, especially with someone you've just met. It's completely okay if you're not ready to share right away. Building trust takes time, and I'm here to support you whenever you feel comfortable. In the meantime, is there anything else you'd like to discuss or any general concerns you have about your well-being?
I feel a stress lately.
I'm sorry to hear that you're feeling this way, Sumit. Can you tell me a bit more about what you mean by feeling a stage? Are you referring to a specific period of time or a particular emotional state? Understanding the context will help me better support you.
You know my exam is coming.
Ah, I see. So you're referring to the upcoming exam as the stage you're experiencing. Exams can be a significant source of stress and anxiety for many people. It's completely normal to feel this way, especially when there's a lot at stake. Can you tell me more about how you're feeling in relation to the upcoming exam? Are you experiencing any specific emotions or concerns?
I don't feel enough that I am prepared for my exam. Can you suggest me something?
I understand that feeling of not feeling prepared for an exam can be quite distressing. It's common to doubt ourselves and worry about our performance. Let's explore this further. What makes you feel like you're not prepared? Are there specific areas or topics that you're struggling with? And how do these feelings of inadequacy affect you?
Okay, thank you for this session.
You're welcome, Sumit. I understand if you feel like ending the session for now. However, please remember that I'm here to support you whenever you need it. If you ever feel ready to discuss your concerns or if there's anything else you'd like to talk about, don't hesitate to reach out. Take care, and I wish you the best of luck with your exam.
So now we are moving to demonstrate the medical report summarization and Q&A. In this part, we can choose a medical report. So now we are choosing a medical report. In this medical report, the chatbot apply a embedding and generate the summary of our report. So as we see, the chatbot really summarize the summary of the medical report. In this summary, we can see that the age of patient and name of patient and the doctor of the patient and what are the problem that he faces. Now we can ask question from the chat bot with the related which is related to the medical report. So I'm going to ask a question. What is the solution for this problem stated in report? So now the chatbot is going to generate the response related to the query. So here is the response generated by the chatbot. Thank you.